According to HealthNet.com, almost 7 million Americans suffer from some form of gastroesophageal reflux disease, or GERD. For years, to detect the severity of symptoms, patients would have to undergo hours of uncomfortable testing using a catheter, which causes obviously disruptions in their normal lives, not to mention the severe discomfort. But those days are coming to an end thanks to a new system called Bravo 48 and the folks down at Artesia General Hospital. Here to discuss what's going on about this. If you are suffering from acid reflux, this man has got some answers for you. You were the only doctor, and Dr. Insofar, tell me if I'm wrong, the only doctor in the southeast New Mexico performing the Bravo 48 pH test and some of these revolutionary techniques. Is that right?
Right. So what we're talking about today is the Stretta, which is the new endoscopic, minimally invasive procedure for anti-reflux and for heartburn.
So first, let's talk about some of the underlying causes. What gives somebody acid reflux, heartburn? Because it almost seems like everyone at some point is going to suffer from this.
Right. So we know that 60% of Americans have reflux. What is reflux? You lay in bed at night and you have that horrible acid taste in your mouth. That's acid reflux. So we know 60% of Americans experience acid reflux. About 30% experience that on a weekly basis.
Okay. So tell us about this new procedure. So before this new procedure, the minimally invasive Stretta, how would we treat it? Would it be, I mean, would you just buy stock in Tums and hope for the best?
Right, and most people do that. And of course, the biggest other treatment options are medical treatment with proton pump inhibitors and H2 blockers.
Okay.
Unfortunately, sometimes those medications don't work. And there's just been a recent publication in JAMA Neurology to suggest a weak association between dementia and long-term use of those medications.
No kidding.
And we don't want to scare people
Sure.
here today, but because it's a weak association, but people are concerned, and of course, on a lot of people, those medications don't work.
Yeah, absolutely. All right, so let's talk about the Stretta. I believe we've got some video here that kind of shows us how it works here. So as we take a look at this, doctor, walk us through the procedure.
Sure. So the Stretta, again, is a minimally invasive endoscopic procedure. This catheter is put in through the esophagus, and what is happening right now, that lower esophageal sphincter is being treated with radiofrequency energy. You may be familiar with radiofrequency energy and other procedures like heart ablation.
Okay.
And what it does is those levels of the esophagus, which is that lower esophageal sphincter, is being treated with that energy, and what it does is remodels that sphincter so that it can act like a one-way valve. So you can swallow your food, it will allow the food to get into the stomach, but then it will not allow the acid to come back into the esophagus. And that's what that cartoon demonstrates.
That is incredible. So looking at this procedure, doctor, undergoing this kind of procedure, is this something that's being done on an outpatient? Does it require a little bit of a hospital stay to have this done?
Right, so it's a great question. It's an outpatient procedure. It really takes us now less than an hour. You're out of there, and then you're back to work in a few days, and you have minimal symptoms.
Minimal symptoms. Okay. So, in terms of long term, is this like a cure-all? Is this something that has to be done through maintenance?
Right. So the effects are sometimes can linger between 4 to 10 years. Your results. Most patients are very happy with the results. Over 90% satisfaction surveys, and it may allow you to come off the medications altogether, or you may have to take less medication. But reflux is very important. The significance of long-term acid reflux can expose you to having higher chances of developing esophageal cancer. So no matter how you treat it, with medications, with surgery, or with this new procedure, it's very important for people to pay attention to it, because it's just not inconvenience or a pain, but it's actually can cause and put you at risk of developing esophageal cancer.
Okay, so doctor, if we want more information on this, we want to sit down and talk with you or someone at Artesia General Hospital, how do we contact you?
Yeah, so the best way is to get on our website at Artesia General Hospital. I believe we're the only one in the state that offer that procedure. Of course, talk to your doctors. There are other procedures for reflux, and the key important thing is just to make sure you get treatment for the persistent reflux.
Fantastic. Doctor, thank you so much
Thanks
for your
for
time
having
this
me
morning.
here today.
Absolutely. Again, guys, for more information on how this can potentially benefit you and maybe put the Tums away for good, head over to casa.com.